Hello everyone, my name is Rinda Monica. In this video, I will present the task conversation 26 case with the title in this case is Discuss informed consent about a state obligation to provide emergency medical care. Okay, I will read the case. Case study 26. State's obligation to provide emergency medical care. Mr. H.S. fell off a train about 7:45 p.m. on July 8. As a result, he suffered serious head injuries and brain hemorrhage. He was taken to the local primary health center. Since necessary facilities for treatment were not available at the primary health center, the medical officer in charge of the center referred him to the nearest hospital for better treatment. H.S. was taken to the hospital at about 11:45 p.m. on 8 July. The emergency medical officer inside hospital, after examining him and taking two X-rays of his skull, recommended immediate admission for further treatment. Nevertheless, H.S. could not be admitted to the hospital, as no vacant bed was available in the surgical emergency ward and the regular surgery ward was also full. He was thereafter taken to another hospital at about 12:20 am on July 9, but he was not admitted there on the ground that no vacant bed was available. He was then taken to another hospital at about 1 am on July 9. He was not admitted to the hospital on the grounds that the hospital has not net emergency or neuro-emergency department. At about 2 am on July 9, he was taken to another hospital, but also was not admitted there because no bed was available. At about 8 am on July 9, he was taken to an institute of neurology. Upon the doctors discovered a hemorrhage in the frontal region of the head and determined this was an emergency case that could not be handled at Site Institute. At about 10 am on July 9, the patient was taken to yet another hospital, but was also not admitted there on the grounds that the hospital has no neurosurgical facilities. Ultimately, he was admitted to a private hospital, where he was treated as an inpatient from July 9 through July 22. Okay, and then I want to answer question. The question is a short what is correct for the aforementioned hospital to refuse to provide medical treatment to HS and transfer him to another hospital? My opinion is no. I justify the above question because actually the hospital referred to above doesn't reject Mr. HS unilaterally, but they cannot provide first aid to Mr. HS because of the lack of medical facilities and service available in each of these hospitals. The hospital moved Mr. HS to a number of hospitals so that Mr. HS quickly got first aid and got the best treatment. If the hospital did not immediately provide medical treatment to worry about the patient's life, or Mr. H.S. couldn't be helped because Mr. H.S. suffered a serious head injury and brain hemorrhage, which in my opinion is quite dangerous for Mr. H.S. health. If not taken seriously, cannot lead to fatal event or can result in death. If anything happens with Mr. H.S., the hospital could be sued for negligence or service and depriving patients or their right to life. Mr. H.S. need medical service with the facilities needed by him. Okay, this is my opinion. Thank you.